Welcome to the special Autism Ontario webinar event, the continuation of ABA services during COVID-19 restrictions. 1 year later, if you can all believe that. My name is Matthew Lay, and as always, I will be your host. Throughout tonight's conversation, I have a simple goal. That is to facilitate a dialogue on this very important topic, as well as try and get your questions answered. You can submit your questions at any time in the Ask a Question box that's located right beside me and below the slide window. And throughout the presentation, we'll break periodically to take those questions. If you have any issues, you can click on the help icon and somebody will assist you. And other than that, just sit back and enjoy the program that we have. And to learn a little bit more about that program, I'd like to introduce someone to the stage right now, Dr. Kendra Thompson, President of ONTABA. Kendra, thanks so much for being here.
Thanks, Matt, and thank you for everyone who's joining. We're really pleased to have this opportunity, and I want to thank Autism Ontario for making this possible. And I also want to thank all of our panelists whom you will meet in a few moments. So some of you may remember around this time last year, we offered a similar panel discussing kind of reopening guidelines near the beginning of the pandemic. And it is hard to believe that we are, still battling the pandemic. And we recognize the stressors that this causes and how stressful it is for everyone. So we wanted to provide this opportunity for bringing multiple perspectives together to discuss the impacts of COVID on receiving ABA services or delivering ABA services. And we're hopeful that from this discussion, you will take away some potential things that are working well for people, and then potentially just also some different insights from the multiple perspectives that are joining us tonight. Before we do so, though, I'd like to just start by saying a land acknowledgement. And we're, most of us, gathering in Toronto tonight, but we acknowledge many of you may be joining from different places. So this is the City of Toronto's land acknowledgement, but we also encourage you to think about where you're joining from and the territories you're occupying and what treaties are in effect there. So we acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, and the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. And before we begin, I apologize, that's my dog, just a few brief disclaimers that I might turn it over to Matt to go through, if you don't mind, Matt.
Not a problem at all. So I was worried there that your dog's barking would make my dog bark, but we avoided that. So a few disclaimers for everyone. Information presented at this town hall is for professional development and information sharing purposes, not intended to replace specific professional, legal, or clinical advice for your particular practice. We all know this. Information is changing rapidly, so please stay up to date with federal, provincial, and municipal government and public health announcements. I mean, I think there's one every couple hours, so it's a full-time job. Rates of COVID-19 are different across the province and within municipalities, so be mindful of your conditions in your area when making reopening decisions. And the opinions shared are that of our individual panelists, of which we have a really diverse group with us today, and do not represent any particular group, organization, or the like. And so with that, I think it's time that Okay. Sorry about that. But of course, as soon as I start getting things going, I hit a snag. Sorry about that. So once again, we're going to start off our introduction of our panelists with Shiri Bartman. Shiri is a psychological associate at and is a board certified behavior analyst. Been in the field for 20 years. The question I have for you, and it's going to be for all of our panelists, is what do you hope our audience takes away from this evening?
Good evening. It's great to be here. I'm hopeful that we can have a conversation, like you said, with multiple perspectives. It's been a really difficult year for everyone. So just kind of discussing things that have worked, maybe some silver linings, and some of the strategies we use to get through it.
Right. Thank you. Next on our list is Dr. Rosemary Kandilek. Dr. Rosemary, I'm sorry, you're Associate Professor in Applied Disability Studies at Brock University and a clinical psychologist, 30 years experience. What is your hope for our dialogue this evening?
Am I coming through?
You are now. Yeah, you muted on the way in. I muted you. You're good.
All right, great. Sorry. I think what I'm most hopeful about is we all have different experiences, and I think it's really important that the folks in our audience get the opportunity to hear those perspectives and take away some notion of the other person's vantage point. Because when we're clinicians, it's really important to think about how what we're doing is impacting the family in the big picture, not just our little clinical slice. And so that's what I'm hoping for, is that each of us will learn. And I'm learning so much from the panelists myself. And it doesn't matter how many years you do this. If you keep your ears open, you'll learn a lot.
Excellent. Excellent. Our next panelist that we're going to go to is Carabeth Zorzos, clinical psychologist, board certified behavior analyst, and director of Launch Behavioral Health in Toronto. What could be said that hasn't already been said about what our hopes are for this discussion this evening?
Well, thank you for having me this evening. I'm looking forward to the discussion. I think Shiri and Rosemary have said it quite nicely. You know, I would love to get additional perspectives from everyone on the panel and get information from the viewers and just questions on some of the things that have worked this year, some of the challenges, and hopefully learn from it.
Excellent. Excellent. Okay, so we're going to move now to Aviana Foster, Master of Arts student at Brock University in Applied Disabilities Studies program, also working currently as an instructor therapist, providing ABA services to children on the spectrum. Aviana, welcome, and let us know your thoughts and hopes for this evening.
Thanks. It's great to be here this evening. In addition to all of the great things that have been shared so far, I'm hoping to share some of the successes that have come out of the past year and talk a little bit about how we can maximize support as we continue to work through this interesting time together.
It is nothing if not interesting. Thank you, Aviana. I'll be coming back to you shortly. Speaking of unique perspectives, I'm going to call on Philip Lerner, who's self-advocate and a full-time undergraduate co-op student at the University of Waterloo, studying for BMath honors statistics and a computing minor. That's got to be a lot of work, sir. What are your hopes for what we get out of this evening?
Well, my personal hope, this is for me, is I haven't had ABA in so many years, and I'd love to hear about how it's changed and how it's changing during the pandemic. And then also, we have a bit of a unique opportunity tonight because more than 25% of our panel is autistic. So I'm really hoping for those voices to be heard.
Thank you. And I'm sure your voice will be heard. We're looking forward to hearing from you. Another unique perspective comes to us by the way of Andrea Helfley. I knew I was gonna butcher it. Hayfley. I apologize. I said it would be easy since my last name's Lay, and then I forgot the first part of it. You're an elementary school teacher, parent of 2, one with complex needs. That's got to be a lot. Welcome, and maybe you could talk about your hopes for this evening.
Yeah, I think I'm very, very thankful to be part of this panel. I think it's really interesting to understand not just what all the families are going through right now during COVID, but also families who have children and youth with autism who highly depend on ABA services, specifically IBI for our family, and just understanding how services have changed during this past year not just affects the child alone, but also affects the family at large. And being able to share that voice is a huge privilege of mine. So I'm looking forward to not only sharing that piece, but also learning from everyone else on the panel. So thank you.
Excellent. We'll be coming back to you shortly. Our last panelist, or not our last, but the last one that I will introduce, is another self-advocate, Alec Pemberton, diagnosed with autism at 18 months old, received IBI therapy as young as 20 months old. Fast forward many years later, and you will soon graduate from behavioral science program. Congratulations on that, sir. And maybe you can share some final words on our hopes for what we get out of tonight.
So my final hopes for tonight are the getting you to look at is the it affected us. I managed. Oh, did I come? All right, there we go. So yeah. I want to give you a perspective of the autistic, of how this pandemic has affected us. I managed to interview a few of my friends to get their experience as well, and yeah, just overall I managed to witness a few placement stuff at college of how we are doing telehealth sessions, and yeah, other than that, I'm happy to be here.
Excellent. Well, thanks so much for that. Okay, I'm going to take everyone through a little bit about how tonight is going to work, and then we will get right into why we were here on the content and the like. So we've got a number of topics that we are going to be covering, and we've come up with some ideas of what it is that we want to cover. To make this the most efficient that it can be, I will be going to individual panelists before I bring in the whole panel at the end. Throughout the presentation, please be sure to submit your questions using the Ask a Question box. Those questions will be filtered to me, and I will aspire to get you answers. So we're starting off with well-being and mental health. And where we're going to start on that is we're going to start with Andrea, our parent advocate. Andrea, can you describe for me what your ABA services have looked like over the past year?
Yep. So to give you background information, my daughter is currently 12 years old. She's been receiving intensive behavioral intervention services since she was about 6 years old, so quite a long time now. There was a huge disruption in services when COVID started because of all the restrictions. We were bound at home. So that being said, that totally changed the complexities of her receiving services, our workflow at home, and just myself as a parent being able to balance work, my 2 kids, and also being able to ensure that she receives the programming. In terms of well-being and mental health, it's huge. My daughter is cognitively at a 12 to 13 month old level, at a baby level. So she does not understand what is happening. So instantly, her 30 hours of services every day were cut off, and she was homebound 24/7. So like everyone else in our province, we were stuck at home, and you can tell like lack of social interaction, lack of consistency, lack of consistent scheduling. So in terms of her well-being and mental health, there was a huge gap in terms of how she was coping. Behaviors in terms of just not understanding how to occupy herself, right? It was very hard for me as a parent, for my own well-being and mental health, to be able to balance work and also ensure that I could entertain her or provide her somewhat of a level of service that she was receiving, not anyone close to what the IBI clinic was providing for her, but it was challenging. And I think what the biggest thing that I wanted to share is that it's really important for clinics who are providing services, whether it's face-to-face, online, or at a hybrid perspective, is that take into account what the families are going through. Ask the families how would they like services. Do they want one-to-one through a Zoom call or through a Google Meet? Providing the level of coaching that the family can handle, because there are so many other intricacies in their own lives too. So yes, there was a huge drop in terms of how Bella was coping, but thank you to the team at her IBI clinic. They were able to connect with our family, find out how it's going in terms of our family and our health and just our daily schedule. And they were able to tailor the programming to meet our whole family's needs, so that she was still able to receive a level of programming, but also be able to make it successful in our home life, right? Because in the end, it was myself and my husband sharing these programs and these what next for her in the home environment. So that's my biggest thing. Find out, talk to the families, get to know them, ask them what they need, because all these children and youth who are getting ABA services are connected with someone else, a caregiver, a parent, and it's really important to listen to their voice and have an open mind, because expectations have to change, programming has to change, and just a level of understanding and empathy too. So that's my take.
If we were listening to you back when this first happened and everything did change, what was the impact on the greater family unit? Your other child, your husband, yourself. What was the impact for you guys?
I think the biggest thing is being able to be okay to let go of the expectations that you had prior to the pandemic. We had an amazing workflow where we would be able to send our daughter to the clinic. I was able to go to work. My husband was able to go to work. My son was able to go to school. But because of the pandemic, everything changed, from home life and work life and just how we go about being in the same home together. So in terms of just, I don't know, it's hard, right? It's hard for all the families even now, but understanding that letting go of what was and being able to pivot and make a change, because there is light at the end of the tunnel, and it takes a partnership with the clinic, right? A strong partnership.
Excellent. And we'll be coming back to you shortly, but before we do that, we're going to talk a little bit about what that partnership can look like. And it wasn't just the families impacted, right, Shiri? I mean, in your clinic, staff were impacted as well. And the whole way you had to conduct your practice. Can you talk a little bit about the staff impact and the impact that you saw?
Mm-hmm, sure. Yes. So I think the key word, or the word I said the most over the last year, is flexibility. And so I think we needed to adjust really quickly and be flexible. And it's been a bit of a roller coaster ride, because at first we had to adjust to provide services via telehealth when we were in the first initial lockdowns. So that was difficult. There was a lot of staff fear and anxiety about doing something that they didn't have competence doing, inside families' homes on a screen. And so we did, town halls and training and really came together to think about our collective values as an organization and how we wanted to ensure that we provided continuity of care because the families were really struggling. That was difficult, that whole process. But, the team kind of took that challenge and ran with it, and actually everyone surprised everyone. The families and clients surprised us, staff surprised us in their resilience and their flexibility, which was amazing. And then the second kind of roller coaster ride was returning to the center. Once we were allowed to reopen and provide in-person services, once again, we had to deal with a lot of fear and anxiety and concern from a health perspective. And so same thing, we met with the teams, we did lots of preparation, lots of safety training, and once again, connected with the personal values of our staff and the agency values about doing whatever we could to provide the best quality intervention we could within these kind of parameters and challenges that we were facing. So just really being flexible and staying connected as a team, even though we weren't physically together, was difficult, but I believe we managed as a clinic to do that quite well. And, like said earlier, giving ourselves permission to not having it all perfect right away, to know from a clinic perspective and a family perspective that we're going to do this together and there might be bumps along the way, but communicating with each other openly about what's working and what's not working along the way got us to where we are now.
Yeah. And that's, it's a theme that you hear a lot, is about this letting yourself off the hook for the way things used to be as you embrace, I guess, the new normal or forced to. And it's also nice to hear about, how well people did in the clinic and that, because there's no shortage of those stories either. You don't got to look very hard for them. Next year, we're gonna stay on this topic, and we're going to go to Abiana. And Abiana, in your practice or in the area that you worked, staff, of course, were impacted. It wasn't easy, I'm sure for everybody in the direct support world. Can you talk a little bit about what the impact was like for you and your team?
Yeah, definitely. So I've provided both telehealth and in-person services over the last year, and I've definitely noticed an increase in staff burnout, both for myself and some of the other direct support professionals that I know. And a lot of this is around uncertainty and adapting to changes. When we do telehealth, this comes with a steep learning curve and technical issues and modifications to the programming that we would typically use in person. And then when we're doing in person, there's all of these changes relating to using PPE and providing physical distancing when possible, as well as cleaning and sanitizing, contact tracing, daily health checks, and all sorts of other things that, we aren't used to thinking about in these roles. And one of the things that I really have found very helpful with this is to get support from supervisors. My supervisors have been really great, and working as a team to kind of address some of these concerns has been very important for me personally. It's been a very interesting process.
I'm sure. You talk a little bit about what you saw on the client or, patient side, like the behavior that changes that this impacted?
Yeah, absolutely. I've noticed a lot of changes in terms of behavior with the people that I support. I work with kids, so kids with autism, and the kids that I work with are used to having certain routines, and when those routines change, we tend to see their behavior change. For most of the people that I support, this has meant that their challenging and dangerous behavior has increased. So it's important to make sure that they are staying safe, as are the people around them. And so this is challenging both for telehealth and in-person programming. And a lot of the strategies that I've been using have been in terms of increasing parent and caregiver training to manage some of these behaviors. I know that Andrea touched on this a bit before, but families are doing a lot of extra work these days and taking on lots of extra roles. And so we want to make sure that they have as much support as possible, especially when some of their usual supports, such as school, aren't available. So it's extra important for us to provide that support to families for this reason, and to kind of coach them through some of the things that they're seeing at home.
Excellent. Okay, so we've had the parental perspective. We've been through a couple different models of how it impacted at the clinic level. So thank you for that. Now we're going to move on to the perspective, to Alec's perspective, to the autistic perspective. Alec, can you talk to us a little bit about how it impacted your behavior, those of some of the others that you've spoken to in preparation for tonight?
So at the beginning of this entire pandemic, you have to look at it as a massive shift in routine. And if you have anyone or know anybody on the spectrum, that is a big red flag. So I've heard stories of like people in care homes not being able to see their parents day to day, which would cause a lot of questions and frustration, like, where's mom? I was supposed to see mom today. Where's mom? I've heard of frustrations with mask, and trying to get your kid to put on a mask can be quite difficult with the sensory and like the fabric on the face. Like, you don't usually get that every single day, and now you have to wear it every single day. That's a huge, massive shift in routine and change. You're no longer going to your ABA clinic or at school. So all of a sudden you have to fill out your day, and you can get bored quite easily. I know of like the shift into online learning. I knew of someone that actually much more enjoyed it and preferred it because of the lack of bullying at school. And yes, cyberbullying exists, and that has increased, but the amount of like in-person bullying has decreased, and you get that. And then once you get back into going back to school, it's another change and shift in paradigm, and you just see a lot more of problematic behaviors arising, frustration out of like change in routine and such.
Right. So that's interesting. That's a positive from the distance learning, but clearly also services needed to move to telehealth or virtual. Did you see any positives that have come out of the pivots to getting treatment through Zoom or like services?
Well, yeah, actually. So all of my IBI therapy back 20 or so years ago was at home. It was in the room that I'm in right now. It was down in my basement. It was out at the park where I live. And the beauty of that was the idea of generalization. So you could easily take what you learn from your IBI therapy from telehealth and apply it to the environment that you are learning it in much easier.
Excellent. Thank you for your perspective, Alec. I want to take off on something that you said as I ask Philip to join us. Philip, we heard Alec talk a little bit about the impact in social, I guess, overall in routines. So what do you see as the impact and difficulties regarding routines, social skills, and the like during the pandemic?
Well, first off, just like Alex said, this pandemic, especially at the beginning, has been nothing but intense change. And a lot of things that were actually socially acceptable before the pandemic are no longer socially acceptable. So for example, whenever I see my friends, I usually greet them a high five, something like that. Now, I'm not doing that, and it's a little bit difficult. And then the other thing is, these provincial guidelines are changing frequently, but not at regular intervals. And it's hard to figure out what's okay and when you're outdoors. I will mention
that's definitely
actually
big.
one positive. I'm not sure if the general audience knows about this term, but it's called masking, which is different from pandemic masking. It's basically an autistic trying to hide their autism from the general public. So with these stay-at-home orders, I've actually been finding that I've been masking a whole lot less. So in that way, it's almost been a bit of a relief.
Yeah. Why do you think that is, Philip? Why do you think that with the stay-at-home order, you've been masking less? Is it just that you've been seeing less people, or what do you attribute to that?
Home is just a safety net. And in a safety net, you don't really feel the need to mask as much. It's simple as that.
Right. Okay, thank you for that. What I'm going to do now is I'm going to ask everyone to come back really quickly here, and basically just see if I can get some feedback from everyone on this topic. Anything that anyone feels we maybe should have covered, or anything to add to the dialogue that we just had there. Okay.
I'll speak.
Go ahead.
Yeah, I think I'm learning a lot just hearing from the clinical perspective, the autistic perspective, and just so many similarities. And the biggest thing is we are all going through change, but as a community as a whole, and that's speaking for our people who are our panelists and also our participants who are listening to us, have an open mind. And maybe this pandemic is giving an eye-opening perspective for everyone to just have some empathy that we're all going through our own individual changes, and to have an open mind to learn from where we're coming. It's people shouldn't have to be afraid of who they are and hide in their own very home, right? And even as a mom, right? I cringe when I have to go out in the public with my 12-year-old daughter who's almost my height, right? So I'm hoping that if we're going to look at the positive side of the pandemic, and yes, everyone's going through changes, have an open mind, be flexible, be open to learning. Now, change your expectations, and it's okay to own up to something that maybe you made a mistake or an assumption, but we're all here to help each other to learn better, because in the end, we all want to move forward and be able to grow and understand that we all have a place in this community.
Yeah, I mean, we're all people, right? And one thing that I've learned, and I'm not in the community per se, just on this desk doing these interviews every month, but is that we've all been affected in a very similar way by this, and whether we're frontline workers or we're in virtual events. I understand that some people have been impacted a lot more than others in certain ways, but in general, we are all people that have had to have similar paths through this. And there's a level of empathy that comes when you're able to look across the board at a panel like this of parents and caregivers and the like, and recognize that similar journey has occurred. Okay, thanks for that. What we're going to do now is we're going to move to our second topic, and this is safety in services. And for that, we are going to start with coming back to Aviana. what are some of the important considerations for providing services safely during COVID? What are the things that we should all be thinking about and looking at?
Yeah, this I think has been one of the biggest questions for everyone over the last year in ABA and just in general in our lives. How do we keep ourselves safe? How do we keep each other safe? Something that we've been having to kind of constantly think about. Obviously, we want to start by keeping up to date with the changes and guidelines and restrictions, which can sometimes feel a little frustrating because, you know, one week it might be okay to wear a cloth mask at work, and the next week you need to wear a medical mask. And, you know, you never really know what's going to come up, but, you know, we are all kind of learning this together. So I think being open to changing and realizing that we're going to learn new things and adapt our safety precautions as we go along is really important. And also, as service providers, we want to be aware of some of the risks that come with service interruption. So knowing that, you know, when the people that we support and their families are going without services or even experiencing changes in the way that they receive services, that this can result in unexpected changes in the lives of the people that we're supporting. And this could mean changes to their behavior. It could also mean that some of the skills that we had previously been building with them, they're not getting as many opportunities to practice some of those skills now. And we might need to kind of take a step back and decide, is that the best goal for right now? And if so, how can we work on facilitating that goal in this new environment? And when it comes to managing challenging behavior safely while adhering to the COVID restrictions, that's something we want to be thinking about as well, practicing hand washing and other hygiene practices when we do need to be physically close with people in order to help keep them safe and help keep other people safe is really important, especially now that we've been deemed essential, and we want to have open communication about maintaining safety for in-person services, both with families and with our clinical support teams and anyone else who we think might have useful information for that conversation. I think there's a lot to keep in mind, especially around family burnout and all of the things that are going on with families right now, and finding out what families can take on safely and what is really kind of asking too much right now and might lead to more of a risk instead of being helpful.
You mentioned something that I keep hearing, which is changing guidelines and the like. Those of us who aren't in practice maybe think that you guys might get like a heads up before the rest of the world. Do you find out the same time we do when the premier gets up there and starts talking about something new, or are there channels to help you get prepared when things are changing right now?
I can't speak to other organizations. I know that my organization pretty much does kind of hear about things as other people do, but we also have been in contact with some kind of experts who give us additional guidance when we have specific questions about what is and isn't okay and what does and doesn't qualify as, for example, medical masks, since I mentioned that already.
Okay, excellent. Well, we'll get some insights next. Thank you so much, Iviana. From Carobeth. Carobeth, anything that you want to add there, but also what we're looking to understand is how COVID-19 health and safety requirements have impacted services.
No, it's a good question. I think Iviana covered a huge amount of information there, so I'll try to add to it a bit. In terms of health and safety guidelines, we, at least for my organization, find out at the same time as everyone else. And this has been something that, it takes quite a bit of time to go through, go over, make sure we're in compliance, communicate the expectations. If there are big changes, making sure that our parents and our clients are prepared for those changes. So that's been an ongoing sort of an ongoing challenge, I guess. I think some of the other changes that we've really had to tackle are around how do we provide services such as group programming, social programming that are really integral to our treatment program and we mostly work with young children, preschool, early school age children. How do we provide those safely? And how do we provide those in a way that, that when we're reviewing with parents sort of the risks and benefits, that they understand fully what we can and can't do, right? So for example, historically, when we're talking about consent to join a group or a social program, that's a pretty straightforward process. But now it's much more complicated because we have to talk about the risks of a child not being able to socially distance or not wearing a mask. And what are the risks of that versus not being able to access that type of programming? So that's been, it's been pretty tricky for us. I think one of the changes that has been pretty positive has been our shift towards more virtual parent support. So historically, we would have parents come in on a regular basis and provide coaching with their child related to their goals. And given the restrictions with the pandemic, we had to move those online virtually. And we've actually found that has worked quite well. Our staff have really stepped up and done a lot of work around, supporting and engaging parents. And we're actually finding that parents are a bit more engaged with this process. So that's been a positive aspect for sure.
I've heard that as I've been interviewing others about some surprising pluses that we're able to take out of it. And it's not just looking at that glass as being half full. I know that we've been seeing it in education. We've been seeing it in the workforce as well. One thing that's got to be tricky, though, is handling questions about vaccinations and the status of vaccinations within the staff, within your staff, that is, who work at the clinic. Can you talk a little bit about how you guys have decided to handle that?
I can, and just a caveat before I go into it that I can tell you how we approach it. That may not be the way other people approach it, but this has sort of been what we're doing. So since vaccinations have ramped up, one of the most common questions when I chat with parents, I'll get on the phone, they'll be like, "Hi, how are you? Are you vaccinated?" And it's tricky because we may think as providers, this is relatively innocuous information. I know the staff who are or maybe are not vaccinated, but the tough piece is this is actually personal health information. And in Ontario, personal health information is protected by some pretty clear and stringent guidelines around what employers especially can and cannot share. So our communication has been to parents that unfortunately that's not something that we can share about our employees because that is personal health information. So it's, again, I would say most of our parents have been very, very understanding and supportive of that. But I can see where from a parent perspective that it's a little frustrating because you do want that information.
Yeah, and I can imagine, there's been no shortage of conspiracies and the like growing amongst the pandemic. And it may feel as though hearing that, what are they hiding, I guess, but it's good to hear that there's been primarily a positive feedback from parents and from it. That is good to hear. And to add to that, I'm going to call upon Rosemary to talk a little bit about this topic as well. Rosemary, parents and professionals are interested in knowing. They want to ask the question about vaccination status of their support workers and their clients. We heard that there's some strict guidelines, but a straightforward question for you is, are people required to share that information?
Oh, that's a great question. And I would say absolutely not. It's personal health information. It is meant, even if I've got colleagues and friends who are in multiple different health professions, and one thing we all agree on is communicating your vaccine status would be no different than communicating if you had any kind of other health condition. And that's totally up to people. Now, I know certain individuals who, have their vaccination status everywhere and are very, very comfortable having that conversation. And if somebody chooses to have it, then they certainly are allowed to share their own information as long as it doesn't violate their workplace requirements. But I have also found the same question from staff who are entering into parents' homes or family homes, wanting to know what the family's vaccination status is, and wanting to know if if the parents, especially if they're working outside the home, if they're vaccinated because of the increased potential risk to staff. And the rules are the same for everybody. It's personal information, and it's entirely up to them. What I've heard word on the street is quite often people talk very openly about vaccination these days, but some people who don't are not doing it because either they may have a health condition that prohibited vaccination, and they're doing everything possible to manage PPE and do things right and keep distancing and following guidelines, and they may be doing a really great job at that, and their vaccination status is going to impact them if they get COVID. But it's not just because someone's not vaccinated doesn't mean they're bad or not following rules. And I think there is a bit of social stigma right now for people who, for very good health reasons, have chosen not to vaccinate. So it's a tough one.
Yeah, and I mean, I can imagine if I was going into someone's home and it was my job, that would be a question that I would, I'd want to know. If I'm working frontline in a hospital, I think that information would be available to me. And I'm going, why can't I ask that question? And I guess it's got to be equal. I guess it's got to be equal for everyone. And on that note of everyone, I'm gonna bring everyone back and just see this last aspect of this topic is super interesting. I never really thought of it that way, but it makes a lot of sense that it would have to go this way. Do any of you have thoughts that either are different, unique, or anything you'd like to share on the topic of disclosure of vaccinations, whether it be within a professional, personal setting?
I'll just share a thought I have. My thought is, or question that I'm not assuming anyone has an answer to, is what will happen when schools reopen around vaccinations in schools, because schools currently do mandate vaccinations, those that are part of, the battery of vaccines that kids get typically. And I think it will be an interesting conversation if that goes on the list, which I assume it might one day.
Yeah, I mean, it makes sense, right? Because you can't go to school, or there are certain rules. I don't know them off the back of my hand. There are certain rules, so it would make sense that that's the case. Don't tell Tucker Carlson that, because he will have an opinion. But Alec, what are your thoughts on the matter?
So I remember when I was doing my first placement at college, I had to have a bunch of medical requirements to make sure I was up to date on a lot of vaccination shots. And I think that the COVID vaccination will be put on that list for practitioners and behavior therapists, measure to not give to our clients, because our clients can be at risk if they were to catch COVID.
Right. I mean, it makes sense. It totally does. Okay, so we're going to move on to our next topic, which and I'm going to go ahead and find my place in our program so that I can get this right. But our next topic here is family and client relationships. And I'm going to be starting with Andrea again, and I don't have to say your last name because I already did it once. What is your perspective as a parent in the value building family-client relationships, especially during the challenging COVID-19 pandemic era?
I think through raising my daughter since birth and also learning her diagnosis since she was a toddler and all her complex needs, it's hard to trust others. It's hard to trust the education sector, whether it be public school or even in a clinic environment, because you are putting your own child, who is very vulnerable than typical developing or neurotypical developing children and youth, but trusting others. And I think my advice for the participants and listeners out there is to really take the time to get to know the learners, the children and youth, and the families that they're connected to. Yes, ABA and specifically IBI is a very structured, clinical way of teaching. And just like in public education, there is a spectrum of how it can be delivered. But whether it's in the school environment or a clinical environment, take the time to understand the learner, how they learn best, their successes, their challenges, what they like, their reinforcers, and talk to the families, right? Like my daughter is nonverbal. She has many physical disabilities along with her cognitive disability, but for a parent to trust someone else to take on their child for 30 hours a week to help them move forward in their education and in their growth and development is hard. It's hard for me to let go. So that, and also being in the pandemic, is even harder. So I like what someone else said on the panel, is that understanding that, yes, everyone is going through challenges, and also taking the time to understand the families. And it's okay to pull back a bit, and just sometimes we just need to talk. We want to talk with someone. And I know in my own experiences with my daughter's clinic, they do such an amazing job talking with the families, asking them, what do they need? Tell me what you need. Tell me what is successful right now. That's how they start off every meeting with me. And tell me where you want your daughter to go. And they are partners in education and partners in just parenting my child. So that's the biggest thing, being able to talk to the families and get to know them. And that helps foster a relationship of trust.
Very, very, very interesting. The getting to know during a period where, generally speaking, that is more challenging. So on that, I'm going to go back to Shiri and talk just a little bit about, I want you to comment a little bit on that, because I find where I'm going with this a little interesting. Get to know the families. I mean, Andrew's had a great experience with it, but get to know the families. Yet we're doing it all through a computer now. It can't be as easy, or is it? Have you seen positives, whether it be just in the administering of services or the getting to know of the family unit?
Yeah, honestly, at the beginning of the pandemic, I found myself saying to people who were asking me to see the silver linings that there are no silver linings in this. It was a difficult ramping up to services and frustrating and all the like. So, however, kind of looking back now, more than a year into it, I do think there have been some, I don't know if I'd call them positives, but changes in how we conduct services and how we perceive the like what's important for us to work on, and how to choose goals. And like Andrea was saying, the pandemic kind of moving to telehealth allowed us an insight into the family that we didn't have before. So it kind of forced us and forced our families to further get to know each other. So we didn't really have a lot of choices at first when we had to go onto telehealth. And while intensive IBI programming leads to a very intimate relationship between clinicians and families because we spend so much time together. Being in people's homes all the time made it that much more intimate and close and vulnerable for everyone, both for families and for our staff who were doing this for the first time. So what I saw in my staff was just having the opportunity and the opportunity to connect with families in a way that typically they don't, because our frontline therapists typically aren't the ones who are doing the parent training and the parent meetings. It's usually the more senior therapist or myself. So this, because we didn't have capacity, this allowed the frontline therapists to be coaching families and to be, helping families throughout day-to-day struggles and challenges through the beginning of the pandemic. So it allowed our frontline therapists to develop a competence that maybe they wouldn't have otherwise, and then really be good at it, which was awesome. And then from the family perspective, I think it allowed the parents to see more of what their kids are able to do, because now it was right there in their homes, and to celebrate all of those things and to be able to do some of those things with their kids on their own. And so I really do believe it strengthened the bond and the relationship between the therapists and the families, certainly.
Do you think as things open back up that it's going to get easier to, like you said, there's a bunch of positives that came out from that frontline staff. When things open back up, there's more face-to-face. Will it get easier for them, you think, to forge even better relationships with those clients?
Yeah, I totally do. And we've been thinking a lot about like what we might want to keep doing that we had to suddenly do. I think the technology piece really makes for like efficient communication with teams, like I recently, easily met with a parent and the principal of a school and EAs and speech paths and OTs. Like we had a really quick collaborative meeting. Otherwise I would have had to drive an hour and a half and maybe everyone wouldn't have been able to meet at the same time. So just the efficiency and the ability to bring people together, I think the technology affords us that should stick around. But at the same time, being with people face to face, especially for our learners with autism, is really, really, really important.
Right. Mm-hmm. Okay. So on that note, I'm going to move to Aviana again, and I'm going to ask a pretty broad question here. But what can families expect from staff during this time? So as it relates to rapport and sort of client rapport.
Yeah, I think that's a really important question. I think there's been a lot of change in this, as we've kind of heard from Andrea and Sherry. We are used to being super involved in people's lives and working directly with them, and especially at the beginning of the pandemic. But in some cases, even now, that isn't possible in the same way that it was. Personally, I am doing home-based support right now, so I have been attempting to increase my rapport building with families, and actually very specifically to what Sherry was talking about, I have had the opportunity to really gain some skills in direct parent training with the families that I've been working with, and I think that has been an opportunity that I wouldn't have otherwise had. And also I think it has been helpful for families to have that extra support during this time, and someone who can be there with them in the home when we are trying to kind of reduce the amount that supervisors are coming in person, because we can still provide some of that training over telehealth, but there are challenges to that as well. One of the things that I have noticed, at other points during the pandemic, have provided clinic-based services and telehealth services, and the rapport building in those cases during COVID with all of the restrictions is more challenging, especially with clinics. Usually we bring parents in and talk to them before and after if they have time, and now with COVID we're being encouraged to kind of do these quick at the door drop-offs and pickups, have everything ready to go, don't linger or anything. So that makes it a little bit harder to do some of that rapport building that we're used to doing. And with telehealth, there are challenges that I'm sure everyone has had some experience with over the last year to relationship building and conversation. And so if anyone is kind of having those challenges, I really encourage both families and direct support people to use those supervisors and clinicians and senior therapists as your supports. That has been super helpful for me in terms of, them providing a bridge when you're not able to get that face-to-face time. They can have some more time to converse with families about what they're going through and to converse with you about the things that are and aren't working in your sessions. And that's something that I've found super helpful. And I think if there's one sort of, I guess, takeaway that I could give to families, I would strongly advise you to ask for help whenever you need it and reach out and let us know, because we always want to hear from you and we always want to know what's going on. And additionally, one other thing that I have been kind of trying to do is attempting to explore some new ways to build client rapport while still, using physical distancing and maybe even over telehealth in some cases.
So, not to put you on the spot or anything, but what are some of those new ways? What are things that you found have worked in building rapport that way?
Yeah, it's all very client specific, I will say. A lot of it has to do with, the specific person that I'm working with and what works for them. But some things that are more general that I've been trying are finding verbal routines that don't require the kind of physical contact. So I know a lot of therapists are used to doing what we call sensory social routines or social sensory routines, and doing that, play-based engagement, and then you pause the play and then you get the verbal response or physical response from the client to kind of initiate play again. And, some of those things we're trying to move away from right now because we are trying to distance when it's possible. And so, what are some ways that you can do things like that where you're still getting up and moving, but you don't have to be, touching each other? Like even, songs, which are things that we're used to using that don't require the physical touch. Like one that's coming to mind for me right now is If You're Happy and You Know It, but that's, just one example. And for telehealth, a big one that I find is like online games for kids who can do stuff like that. That's something that they really enjoy. Or even videos. I've done videos with kids who don't have the technical skills to participate. If we can play a video and watch it together, that would be helpful too.
Excellent. All good ideas. And thank you for that. Hearing a lot of positives, we've gone to that, but I have to imagine that, whether it was not that long ago or even recently, that there have been some frustrations. For that, I'm going to go to self-advocate and Alec here. Are you still experiencing frustrations? I mean, we must be. It can't all be, positives that are coming out of this. Can you talk to a little bit about frustrations with maybe other family members or other items with us?
Well, a little. I think with frustration and such, a lot of the time you're just stuck indoors, and you hear stories of relationships getting tested, and it's just exactly the same with whether or not you're neurotypical or you're on the spectrum. And living with my parents for the past year, and so we've clashed, but I think we also have an understanding that sometimes you just need a vent. And I know others, like my friends, that don't have the rapport to be able to go and vent out frustrations that they have with others. And so they bottle it up, and it just gets more and more frustrating as things just and eventually they just explode. And I think it's important that as parents with kids or adults on the spectrum, that you sometimes they just are having a rough day and they're trapped inside. They can't see their friends. They just need to just let off some steam. And I think that's one thing out of this pandemic that I've learned is usually like you get frustrated, but right at the end you feel a lot better because you're able to explain that to someone and they're willing to listen.
So often the answer to problems is communication, and that's basically what you are explaining there. We heard a lot from our professionals who we spoke to before we got here about some of the advantages to at-home learning and or at-home care. Is that what have you been seeing some of those advantages yourself or in the folks that you've spoken to about what's been going on during the pandemic?
Well, yeah. So I remember when IBI first started out, I said before, we would go into the homes, they would build a rapport, and when you're at home and your parents are there doing the therapy with you, and you, like, as a previous spokesperson said, like, they're a part of that moment when they learn something and they are really happy about it. And that's something I think that when you're at a clinician is something that is missing. So the parents' involvement when you're doing telehealth and when you're doing at-home learning is much more heavily involved, and you can build a rapport with your kid a lot easier if you're a part of the behavior. Right.
Watching it happen rather than sort of hearing about it, assuming that everyone is together. And so I'm going to move on now to Philip and ask a pointed question about that. Philip, how important is it keeping families in the loop on therapy progress?
It's always been important pre-pandemic as well, but now it's more pivotal than ever, I would say. Because right now, for therapists who are doing their work, especially for telehealth or virtual, the parents and the family members are basically becoming the on-site therapists, which is a whole new title for them to hold. So they need to know what their child or siblings are working on so they can help.
Yeah, it's very, all parents have taken on a lot more. I mean, I'm a parent and not haven't had the worst scenario with it, but we've all had to take on a lot more in this role as friends, because our kids they're being isolated from their friends as well. So it's interesting to have that therapist sort of title as well. Thanks, Philip. I'm gonna go to Carabeth, and we've talked a fair bit about changes in the way we've had to administer care, or I guess interact with our patients. But have there been changes to how you support and communicate with clients and families during the pandemic that go beyond Zoom or the rules we're all aware of?
No, I think given all of the changes, that we have really been more mindful of parent and family stressors. So I feel like right now is a tough time. In the past year has been a tough time for everyone. But again, many of our clients and families are young families. They may have multiple kids at home. And they may not be comfortable identifying that they're struggling in things such as mental health. So we've been more cognizant of this and providing support and check-ins as much as possible. And we're in a good position because we're part of a larger mental health organization. And we have many psychologists on staff as well who focus specifically on mental health. So we're able to provide that sort of seamless support to families if we find that there are some challenges and parents need extra support outside of the scope of what we can provide as behavior analysts. We're able to connect them with that, and definitely families have been appreciative of that resource for sure. I think the other piece is just being mindful that given the uncertainty, being clear and transparent in any kind of change right now is essential. So even if it's minor changes, I feel like, we regularly write emails or talk to parents at pick up drop off around changes that may be happening at the center, because they find that helpful, and they like that we have that ongoing dialogue. So in terms of changes, I feel like we're definitely communicating more, which is great, and just checking in with them as much as possible.
Yeah, I have to say that, the school board has done so much more communicating throughout this process about things that are going on, and clearly have learned there's an importance to that I don't think is going to go away post-pandemic. Is with the multiple check-ins that you guys are discussing, and some of the things that you've instituted, are they heavily driven by technology? Have you embraced new technologies in practice beyond virtual meeting tools that have helped facilitate that?
I think it's really individualized based on the family. So a lot of what we do, we provide in-person services. So we do a lot of check-ins at pick up and drop off. We do email, Zoom, of course, but we also have a proportion of clients who we work with virtually only because they live in remote rural areas of Ontario. So we 100% have to rely on those technologies to check in and just make sure things are going well.
Well, we've seen it in all aspects of business that more and more people at a minimum are getting comfortable with the technologies out of necessity, and as a result, I think that there are a lot of things benefit there. Does anyone else have anything to add on this topic?
I could do something.
Perfect. Go ahead, Rosemary.
I think one of the things I just would like to sort of come back to from comments is that as we're all providing different levels of support to families, this is sort of one of my ethics questions I get often from practitioners. So I thought I might bring it back because I think when behavior analysts are trained to do certain things, and they get really, really concerned when they have to sort of tread outside and what's the line between what my skills are and what else I can do. So when I'm thinking about the notion of, is it okay for them to spend some of their time on the family's bigger needs when they're trying to provide those services without crossing that line into doing something that is not in their training? And so I just like to comment that what we do and how the family operates has a really direct impact on the person in the family that we're supporting, and vice versa. So I feel like within comfort zone is to remember that families' needs impact our service recipients' needs and vice versa. So we can give them opportunities to chat, and we can problem solve for general things. Many of us are problem solving general things in our own families. Many of us have kids who've moved to online learning where we can empathize. And I think that a good deal of that is part of rapport building in this new normal. And I don't think it needs to be considered outside of our box. And empathy is a critical part of rapport building. So if people are feeling like, oh, I can't talk about that because that's not about this ABA program, I think that affects the relationship clinically. So I would just say, be very mindful about what you're doing. And if the family's needs are really complex, then I think, as Cara Beth mentioned, there's people and places we can refer them to get them more support. And I always remind both the clinicians and the families that some people who have employment have employee assistance programs that isn't as stigmatizing as going and finding a therapist. They're part of employment, and they may be a great place for people to start if they're feeling overwhelmed about life in general. And any one of us can use those kinds of things if we have access to them. And if not, if you just go online right now, there are a number of previously fee-for-service mental health supports that have been funded to be provided free of charge during the pandemic, so that I think every service provider should kind of have a go-to list for their area, because it's going to be different in every area. So for their area, for the families they work with, and for their staff, so that people know how to get that help if they need it.
Rosemary, you mentioned online. Do you have any direction on where folks can go to find that information?
Well, I think it's so jurisdictional that what I would suggest is if you can start at places like the Canadian Mental Health Foundation, who have all kinds of listings, and they have like a listing for Toronto, a listing for St. Catharines, a listing, for North Bay. And so you could start there. If your community has, like Toronto has, a 211, then you could contact them, and they can give you a rundown of available services. But most importantly, I would say ask your provider, because hopefully if your provider doesn't know the answer, we're very good at saying, I don't know the answer to that, but I'm going to go find out and I'm going to come back and tell you. And so, and for providers, I would urge you to look at some of the resources Ontaba has shared with providers as things that are available if you're a clinician who provides behavioral support. But these are tough times, and it takes a village. And I'm not kidding you, when I get emails from my own child's school about things that are available, I then retweet and post those so that parents who aren't from my kid's school board who live in Toronto will go, oh, I didn't know those free things existed. And I think it really, many of us are relying on social media for so much more because it's giving us information in the moment. And we're relying on it to find out, oh, look, this Ontario Psych Association just got funding to give a whole bunch of free therapy to direct care service providers. So then we can direct people there. But it's not a coordinated provincial effort. So a lot of it's really jurisdictional, and we can help. And if people need more of that stuff, I would suggest if their families reach out to Autism Ontario in their area to see if Autism Ontario knows of resources, and if they're professionals, reach out to your professional association and see if we have any resources to share. I think you're muted. We're not hearing you.
I forgot to unmute myself. I've been waiting for a break in this so I can fix the window. I'm not used to doing webinars at this time of day, and that sun's coming in pretty strong. What I was going to say is Autism Ontario is a great place to start. They have community liaisons that can help navigate, or service navigators, I think is the title. And I think most people on here would probably be aware of that. Alec, I think you wanted to add something on this topic, so I'll pass it over to you.
So, yeah, I actually have a question for the providers here, and that's on the concept of like having either a sibling or a parent, just sort of building that rapport with your clients, helping them and modeling the behavior that they are learning. If that is happening at all, because I know that it does help a lot if like someone in their family is also showing like, hey, this is how you do it. And I just want to pass it off to other people. So,
I can offer just a thought.
See your hand too.
Just an example, when we first moved to telehealth, what needed to happen because parents were busy is that siblings were our coaches in some situations. So I think we were lucky in some of those scenarios where we had older siblings that were really willing and really enjoyed having that role to like be able to see what their brother or sister was able to do, to be able to be part of the coaching, to be part of the celebrating successes. And so that's one way that we've involved siblings. I agree with you. I think it is really important, and being in the home via telehealth has allowed us to do some of that. Pre-COVID, we did a lot more of that, obviously, but a little bit.
Excellent. Okay, so we've got 7 minutes left in the program, and we have another topic to get to. So I'm going to move things along just a little bit and address that. So our final topic of the evening is around logistics, and we're going to start with Shiri here. The question that I have for you, Shiri, is clearly there's been some challenges as it relates to logistics, but challenges related to billing due to frequent isolation periods from staff and clients. What are some of the challenges that we may not see on the outside?
Yeah, this one's really been tricky as a small non-for-profit business agency. From two perspectives, from a financial, we need to keep our doors open perspective, but also from a service disruption and cancellation perspective. So because of all of the health and safety rules around, 14-day isolation if you have symptoms, and, outbreak protocols and things like that, we're kind of trying to be really conservative, so we don't let anyone come in with any kind of symptoms, and we're being pretty strict about that, which is really frustrating. So, we have to send kids home with sniffles, or staff have to stay home, whereas before maybe they would have come to work, but now they have a headache and don't feel great, and so they have to stay home, which in turn means service disruptions and cancellations. So someone's not getting treatment that day, and we can't bill for that, and we have to pay the therapists. And so that's been bumpy to navigate, not like having people use their personal or vacation time, but also having to be cognizant that someone has to pay for people to work. Thankfully, there's been some support from the federal government. Otherwise, I think we would have been having to make more significant, difficult decisions around layoffs and such. But it's been a real challenge, and it's been really hard to navigate. I think the biggest piece is the instability and the service disruptions, which impact consistency and routines, which we know is a really big problem. So one of the things we've been able to do is, for those families that are able to, when someone, maybe a therapist can't come into the center instead of in person, they might switch to telehealth that day if they're able to. Of course, if people aren't actually sick, but they're just isolating because of a caution. So we've been able to be a little bit flexible there, but it has certainly caused disruption, frustration on parts of both families and staff, and a real financial instability, and having to, as a business, forecast is really difficult. Being able to kind of feel safe to tell everyone everyone has their jobs for this month because we're doing okay. That's been really difficult. So just the disruption overall has been challenging.
Yeah. Mm-hmm. So hard. I know. I mean, it sounds small compared to what you guys are doing out there on the front lines, but we were going through a similar spot when this hit. The need for webinars, virtual events, just skyrocketed. It went kind of nuts. But not knowing how long this is going to last, and not knowing what's going to happen, you're in a situation where you're hesitant to load up on staff, because if it falls to pre-COVID numbers, what are you going to do? bring on a bunch of people and let them all go. So you're asking a lot of people during a time. You're asking a lot of people who are uncertain about their own future in a time where all of these anxieties we've been talking about, they're hitting everybody. So, yeah, it's a very interesting perspective.
That's the other piece. Like, our staff are also families with kids who are like yo-yoing back from online school, in-person school, and they have to be in our clinic to provide service to families. And so all of that is like a really big thing to navigate and to keep, all the balls in the air. Yeah, for sure. Asking a lot of people.
Excellent. Okay, I'm going to correct a statement that I just made. I am so used to doing these over the lunch hour that I have to be very cognizant that they're ending because people have to go to their next meeting and the like, but we actually have more time reserved, so we're not quite on the clock as I at first imagined. I'm going to go for one more, I'm going to go to Carabeth for one more take, then I'm going to bring everyone back and we can just free flow from that point. Carabeth, what are some of the differences in clinic operations that have come about with the pandemic?
So I think a lot of these are going to be very similar to what Sherry mentioned. So first and foremost, I think from a financial perspective, it's been very, very challenging. And yes, there have been government supports, but there are several agencies, including my own, that are part of larger agencies, and because of the federal government requirements and all of that, we don't necessarily meet criteria to receive additional funding support. So that has been really tricky and has forced us to be as creative and flexible as possible in terms of keeping the doors open and keeping the lights on, keeping staff paid. I think one of the pieces that people don't realize over time is the cost of things like PPE and extra cleaning that are required with the pandemic. And those, when we first reopened, it's like, okay, it's going to be a few months maybe. But a year later, those costs do add up quite significantly. And if you don't have funding for that, it makes it very difficult just from an operations perspective to come up with those funds without having to pass them on to clients and families. So that's been a bit tricky on our end. I think the other piece from an operational perspective is we are very much used to, having clients come in and inquire about service and onboarding clients. But because of the space restrictions and the distancing restrictions for COVID, we have run out of space. So we're in this situation where we have demand because that continues. Parents continue to require supports, but we do not have the space to provide services. So we're having to, again, get creative around, are there other pieces that we can offer in the interim? Are there virtual pieces that we can offer? And just find ways that we can support families so they don't have to wait months and months and months to get those in-person services.
Yeah, the business side of this is one that, we hear about, in a lot of places, on the CBC, you'll hear an interview with, restaurateurs and the like who are struggling, but a completely different story when you're, trying to help and have those really real concerns because you got to make payroll. You can't not do that, and you gotta keep the doors open. Right? Yeah, exactly. Okay.
Exactly.
So with that, I want to remind everyone that we are here to answer any questions that you have. We have one question that is pending in the Q&A that I think we're handling over text, so don't think we've ignored you. But anybody else, please feel free to submit your questions there, and I will aspire to get you answers from our staff. So this is part 2. we started this over a year ago, if we can all believe it. Some of us may feel like it's been a decade. Others, I'm sure, know that it feels like it's just flown by. What are the biggest surprises for you guys about what's changed in the last year? Go ahead, Andrea.
I think creativity. Creativity on the family side and also the clinic side. I think both ends of the relationship want the best for the children and youth. And that being said, that builds an opportunity to say, you know what, we need to get it done. How are we going to do it? I love what Sherry was saying, that being in a pandemic has really strengthened the bond between the clinic and the family. And speaking as a parent myself, it really forced me to, you know what, you are right on deck right now. You have to learn how to do the programs and deliver the programs. So it also gave me ownership that, you know what, I have a big hand in my child's learning. And it gave me an opportunity to learn what the clinics are doing with my child and just have a greater appreciation of what they do every single day. But creativity is the most important. Like, if there's always a way to teach these children, they don't learn like everyone else, but they do learn. And if they get to know who our children are, they can do wonders just like everyone else.
Go ahead, Sherry.
I agree. I agree that creativity was a really obvious. And I think resiliency, like everyone felt like this was going to be so hard as we were prepping, and it was, but then we did it. And then as, kind of curveballs get thrown our way with different rules and changes, we struggle, we complain a little bit about it, and then we find solutions, and then we just do it, and we do it well. And we're, I feel kind of badly at the beginning. I had lots of thoughts about like, oh, this client won't be able to do this, and this client won't be able to do that, but they did it, And so I think like really eye-opening, fresh kind of perspective about like, our clients and our own abilities to do hard things, like we can all do these hard things. One example is, we thought that it would be a really good idea to teach everyone how to wear a mask. A lot of our kids can't or couldn't wear masks when this thing first started, from all kinds of sensory issues. It's weird. It's, weird and hard and all that stuff. But we taught everyone to wear one, and it wasn't that hard. It was just, like we did it. We thought we could do it, and then we did it. So just that resiliency and creativity, I think, were really nice surprises.
Yeah, it's remarkable. I mean, history should always teach us that we are capable of much more than we realize we are when faced with adversity like this. But it's amazing when you're going through it, and we're all going through it together, to watch from the smallest ones, a 5-year-old who, at first the mask was such a weird thing, and now he'll go anywhere with it, right? He's was in class for months with it, and it's become part of how they do things. Alec, what has surprised you the most over the past year?
I think the flexibility that clients and ABA therapists and parents have been able to demonstrate. I think that as clients, it's difficult when you're hit with like change in routine and change in that, but I think also learn how to be flexible about it. So when there's a new restriction put into place, and when there is a new routine, getting into that new routine has been, at least for me, a little bit easier than it would be before the pandemic.
Interesting. Very famous quote about one of the most dangerous sayings in the human language is because we've always done it that way. And I think, we were all seeing that just because we always did it that way doesn't mean it was the best, and that there's a lot of aspects of doing things in a different way. I believe that Philip, you have something to add on this matter?
Yeah. For me, my biggest surprise has been the ingenuity of some people during this pandemic. This is not exactly an autism example, but I do know a teacher in the Peel District School Board. They have decided to go completely gradeless with their virtual classes, where instead of assignments being focused on formal grades, they're now much more about informal feedback. And then grades are really only discussed once or twice throughout the semester. And from what this person has told me, their students are actually more involved than they were even pre-pandemic. Attendance rates are higher, and students are just happier in general. So it's possible that some of the things that we're learning during this pandemic, maybe they should continue.
Very interesting. And we have seen a lot of really what would have been looked at as, I think, very rogue or out of left field ideas being adopted and being successful, which is very interesting. Abiana, go ahead.
Yeah, I just wanted to build a little bit off of what everyone else has been saying. One of the things that has surprised me a lot has been the ability to individualize support even when we have these kind of restrictions that apply to everyone, and finding ways to maximize benefits and minimize risks based on the specific situation of the child that we're supporting and their family. I think we've done a really good job of figuring out what works best for each individual situation.
Rosemary?
One of the things we're talking about, the pivots and the creativity, and one of the things that I'm often charged with respect to this kind of work is, how do we deal with things? We've had such rigid rules around information and how we can do things and what kind of online system is acceptable and that meets the health regulations, and it's been stifling for those of us who are also behavior analysts and regulated health professionals before the pandemic to figure out what we could use. And oh my gosh, if I was going to put something in a digital archive, like the layers of consultation I would do to make sure I was following the rules to the T. And then when we're asked to pivot overnight and they're telling us, do the best you can do, just make sure your clients understand the risks, is kind of something we've been telling them all this time, is that sometimes there's imperfection in what we do. And, if the only usable, virtual field for somebody is FaceTime, because that's the only device they have and that's what they can use, and they don't even have the bandwidth to download more apps. Previously there'd be 17 layers of people saying, no, don't use FaceTime for that conversation. And during the pandemic, we've had to say, okay, well, if you're there and you don't have the bandwidth and that's what you can talk on, as long as you understand the risks and you're willing to have that conversation, then I can do that with you. And I'm hoping that this is going to help us to reach previously disadvantaged folks in the province who, by virtue of the technology requirements from the legislative side, has meant that even if we could provide the service, we couldn't connect with them. You think about the bandwidth improvements that have been done now, and I think of First Nations communities and hoping that we can continue that bandwidth improvement, which will help us to reach people. So I see kind of one of the things that I'm excited about is this has demonstrated that our social system can do more to help us access people, and we're going to hold them to that after this pandemic. Did I just make Matt leave?
It's fascinating hearing everyone's voice right now. Just learning a lot from everyone right now, so it's awesome.
Absolutely.
It is.
Before we move on, Rosemary, we do have an audience question that was for you, but if anyone else has thoughts on it, they can step in. What are your thoughts on long-term implications for in-person clinical supervision that might come out of the changes that occurred during COVID?
Oh, wow, that's a great question. I would say this. I think we're now have examples of what works in person, what may work better in person, what has worked online that we didn't think could work. And I think it's going to challenge all of us from the clinical supervision perspective to figure out ways of moving forward. I'm personally a really big fan of being in the room, because my best job as a supervisor is moving that person out of the chair and taking the chair myself and showing them what I can't necessarily explain in words all the time. And there's times for needing that, but some of the other modalities can work really well. I think one of the things this pandemic has brought is far more research and dialogue in professional like journals and conversations and conferences around how to do it better and well. And I think it's been really wonderful to watch resources develop that include how to do online things well. Some of us have added research projects to our agenda that are about evaluating how we can do these things better online. So I'm hoping that we will continue that dialogue and come back to the same things we think about when we provide services. What works best for whom in which situation? Because that's really, it doesn't matter what you're doing. That's really what we have to pay attention to. And if you don't have research to tell you exactly, then you've got to do your very best to match with what we know and go from there. So I think it's a great question, and more work's being done.
So we've been able to cover all of our topics. Cara Beth, I'll let you comment before I start to move things on. I apologize.
No worries. I just want to jump in with Rosemary and state I absolutely agree. I think that we have to remember that that online and virtual is a tool in our toolkit for very specific situations and clients. But I would, I think that there will always be situations where you have to make a decision of, is it going to be are there better clinical outcomes if you as a supervisor are physically there in person? So it's, and until we have more data, I think it's those decisions around what's going to be best for this person at this point in time.
But at a minimum, it feels like some of the handcuffs have been taken off, and there's more opportunity for tailoring that care. If any of you have watched an Autism Ontario webinar, at the end, I often give the guest an opportunity to give their moment of Zen, that thing that they want the audience to take away that either has already been said or maybe somehow got missed throughout. Now, usually there's only one person that I'm talking to. Here we've got quite the large panel. So I'm going to go in reverse order from where I did before. And I'm going to ask everyone, starting with Alec. Alec, what do you hope, what do you want to say to the audience that maybe hasn't already been said, or what do you hope they take away from tonight's presentation?
Well, I hope that the audience takes away understanding of all forms of what we have been through throughout the pandemic, the positives that have come out of it, the things that we have learned, the things that we struggled with, and the things that we had to overcome as one community altogether.
Right. And it does feel like it was done in a very collaborative and communal approach. Andrea, same question for you. What do you want our audience to take away from, or what hasn't been said?
Very similar to what I've been always talking about. Be open. Just be open to get to know the families, the learners that come to the clinic, and just to be able to pivot. And it's okay if we make mistakes. We're in this together.
Right. Philip, your thoughts?
First off, I just wanted to say thank you to the audience for joining us for this panel. And my best advice would be try to take something positive out of the pandemic. We have actually mentioned a lot of positive things here, ingenuity, creativity, but try and come up with something for yourself. Autism related, ABA related, non-autism related, doesn't matter. Just what have you learned from this year?
It has been a very positive conversation, and I don't think that we're, putting it on. Clearly, I think a lot of people have come kind of over that hump, and if you haven't, it's important to recognize what has been positive. Ibiana, what's your parting words for everybody?
I think I'm going to go back to the idea that the people with autism, their families, and service providers at all levels are a team in this, and we want to work together and communicate with each other. So making sure that you let everyone know what's going on, because we can't know anything from any member of the team who doesn't share kind of their perspective. And especially when that comes to mental health, we all need to make sure that we're taking care of our mental health in every way that we can.
Carabeth, is there anything that hasn't been said? Is there anything that you'd like to leave our audience with?
I think I'm going to borrow from Philip in that, really pulling from what the things that have worked for us this past year and just focusing on those positive pieces.
Rosemary, your thoughts?
I think a really important takeaway from all of this is just the listening part. I think the more we listen to each other and really not just wait for our turn to talk, but truly listen and appreciate people's perspective, try to see it from their angle, and it just makes us better people. And by virtue of that, it strengthens the team that we all work on together. And I just think that when I'm a clinician, I always say the experts when we come in are the family and the person we're supporting. They're the expert, and we're there to provide coaching and support to help them reach their potential. And so, I think what I loved about tonight was just the fact that our self-advocates and family give us that perspective that we've got to remember what's important here.
Sherry, you had the easy job at the start of saying what you hoped for the evening, but you've heard a lot of really great statements of what everyone else wants to take away. But you get the last one, so I'll let you let us know what your thoughts are on what happened tonight and what the audience should walk away with.
I think for me, it's as clinicians, it's our obligation to always do our best, and in unprecedented times, sometimes we don't know what that best is, and we have to figure it out. And then the more we know and learn and grow and research, then we do better. But to just give ourselves that kind of permission sometimes to just kind of try things out.
Amazing. Well, I'd like to thank you all for being a part of this panel this evening, not just for what you shared, but clearly what you contributed over the last 365 days and throughout the pandemic. I found the conversation very enlightening, as I am sure our audience did. I do have to call back upon Kendra to bring her back before we go, so I'm going to go ahead and do that. A reminder to anyone who did not get their questions answered that we are going to try and do that afterwards in writing from Autism Ontario. Kendra, no dog barking, which is a good sign. How did you feel tonight went, and do you have anything that you'd like to sort of leave the audience with before we adjourn for the evening?
I just, again, want to thank all of the panelists for being here and giving us your time this evening and sharing your perspectives. It's incredibly valuable, I think, to have conversations and keep having conversations and helping each other, you know, as one big team. And I hope that we can have many more of these kind of multiple perspective type conversations over the next little while. But yeah, just thank you for the things you're doing. Thank you for sharing your lived experience. And I hope that everyone continues to be resilient and stay safe. And yeah, thank you, Matt, for your moderating. That was awesome. And I just wanted to note too that I believe that this will be on the AO website, the video recording of this. So if you want to tell your friends that weren't able to join us tonight, they can catch it there.
Look at you taking my job from me. Thank you so much, Kendra. And that is a wrap. So yes, this is recorded. It'll be available on demand tomorrow at the Autism Ontario website, or at this link, actually. So if you found this valuable, please share it with your loved ones, family, anyone who you think would gain something from it. The more people we have coming through these webinars, the more webinars we're able to put on for you. And with that, I will say goodbye. Thank you so much for your participation this evening. Excuse me. And we look forward to seeing you on our next Autism Ontario event.